The nervous system is a complex network of nerves and cells that carry messages to and from the brain to the rest of the body. The main function of the system is the control of the body and the communication between parts, and it maintains homeostasis by providing moderating response and regulation parts, and it maintains homeostasis by providing moderating response and regulation of all systems in the human body. The nervous system is made up of two main parts: the central nervous system, which consists of the brain and the spinal cord, and the peripheral nervous system, of all the nerves that branch out from the spinal cord that reach to all parts of the body. The basic unit of the nervous system is the nerve cell, also known as a neuron, which consists of a cell body with a nucleus and two different types of nerve fibers known as axons and dendrites. The human brain contains over 100 billion neurons, and the axons and dendrites are what make neuron communication through the body possible. Neurons can be put into four different categories: sensory neurons, motor neurons, interneurons, and neurons in the brain. Sensory neurons are activated by sensory input from an outside environment. These inputs can be both physical and chemical, and they correspond to our five senses: sight, hearing, taste, touch. Motor neurons are what connect to muscles, glands, and organs within the human body. These neurons transmit signals from the spinal cord to skeletal and smooth muscles, which directly controls all our muscle movements. There are two types of motor neurons: lower motor neurons that travel from spinal cord to muscle, and upper neurons, which travel between the brain and spinal cord. The next type of neurons, known as the interneurons, are the ones in between spinal motor neurons and sensory neurons. These neurons allow the transferring of signals between sensory and motor neurons. Finally, the last type, which are neurons in the brain, are much more complex and harder to classify than the others due to the sensory processing and motor processing that the brain does through visual or auditory cortex and the cerebellum or motor cortex. Researchers are still trying to find a way to classify the extensive number of different neurons in the brain.
Alzheimer's disease is a progressive disorder that causes brain cells to waste away and die. Alzheimer's is the most common form of dementia and the sixth leading cause of death in the United States. It alters thinking and reasoning, memory, personality, behavior, ability to make judgments and decisions, and the ability to plan and perform familiar tasks. Though it is not fully understood how it begins, Alzheimer's causes brain cells to lose the ability to function and communicate with other cells properly. This damage takes place in the memory regions of the brain first, then spreads in a predictable pattern throughout the rest of the brain. Plaques and tangles are two ways that cells are damaged and killed. Plaques are proteins of beta amyloid that build up between cells, hindering cell-to-cell communication. Tangles are twisted fibers of tau protein that build up inside of cells, preventing them from functioning properly. This destruction of cells is what triggers memory loss, changes in personality, and trouble functioning. There's no real definitive cause of the disease, but it is believed to be a combination of genetics, lifestyle, and environment. Risk factors include age, family history and genetics, Down syndrome, past severe head trauma, poor sleep patterns, and lifestyle and physical health. Lifestyle risk factors include lack of exercise, obesity, smoking, high blood pressure and cholesterol, poorly managed type 2 diabetes, as well as low education levels or lack of mentally and socially stimulating activity throughout life. Though Alzheimer's is not preventable and has no cure, maintaining a healthy heart may lessen your risk.
With 35.6 million people in the world living with dementia, 1 million people are living with it in Brazil. 12% of the population over 65 in Brazil are living with dementia/Alzheimer's disease. In a study performed in 2000 to 2009 Age and sex standardized mortality rates were determined in Brazil's state capitals. The study showed an annual growth rate in mortality in the range of 60 to 79-year-old bracket of 8.4% in women and 7.7% in men. In the 80 or older age bracket, the increase was 15.5% in women and 14% in men. In the 10 years recorded, the study showed 1,505,326 deaths occurred from the age of 60 years or older in Brazil's state capitals, of which 0.4% were attributed to Alzheimer's disease. In Brazil, many people living with Alzheimer's are being taken care of by a caregiver who is a relative caring for the individual with Alzheimer's disease. Caregivers or relatives were associated with worse health outcomes. Possibly, if the people living with Alzheimer's disease had professional healthcare help, then maybe there would be an increase of quality of life and lifespan for people living with Alzheimer's disease, and a decrease in overall stress on the caregivers who take on this responsibility. This also provides great economical stress on caregivers to provide good quality of life for the relative living with Alzheimer's disease, where it may be cheaper to have healthcare professionals take care of the patient.
Alzheimer's in Alaska. Recipients vary by area, as much as 1,605 in Anchorage to as little as 28 in Yukon, but it totals to about 3,046, whereas the providers that they have to provide to Alzheimer's patients is approximately 480. It depends also recipients by ethnicity. It goes up to 77% if you are a Caucasian member in Alaska, or even as low as 2% if you are a Hispanic member. Typically, cost of memory care in Alaska ranges from about $500 to up to $7,000 a month. Currently, there is 110 people living in hospice that has a diagnosis of Alzheimer's dementia. Whereas hospitals, there are approximately 1,400 emergency department visits per 1,000 people with Alzheimer's dementia. There is approximately 18.2% dementia patient rate. Moving on, Alzheimer's disease is one of the few major causes of death that is increasing in Alaska. Between 2000 and 2011, deaths due to Alzheimer's increased 17%, whereas on the other hand, heart disease, cancer, and stroke have all decreased. For Alaska, there is about $66 million Medicaid costs for caring for people with Alzheimer's. This is expected to increase to 63.9% changing costs from 2018 up to 2025. Whereas on the other hand, for Medicare, there is about $22,000 per capita spent on all patients with Alzheimer's dementia. There is 8% of Alaska Medicaid recipients that are under the age of 65, which is actually surprising to its rarity because it's more difficult to diagnose Alzheimer's dementia in younger individuals. There is lack of awareness about eligibility for the financial support from the administration and other sources. Younger onset individuals can use Social Security insurance and supplement security income as part of the Compassionate Allowance Initiative.
Both Brazil and Alaska have high populations of people living with Alzheimer's. Although these places are vastly different, they both have similar issues when it comes to caring for patients living with Alzheimer's disease. 60 to 80% of dementia and Alzheimer's cases are diagnosed around age 65. In Alaska, there are over 6,100 people living with Alzheimer's disease or dementia. It is predicted to increase to 11,000. In Brazil, there are over 1 million people living with Alzheimer's. In both Alaska and Brazil, age and gender are factors that can affect Alzheimer's disease, along with other risks such as depression, family history, social isolation, and traumatic brain injury. In Alaska, between 2000 and 2011, deaths due to Alzheimer's disease increased by 17%, while in Brazil, between 2000 and 2009, ages 65 to 79, deaths due to Alzheimer's increased by 8.4% in women and 7.7% in men. There are about 99 Alzheimer's and dementia care facilities. From age 80 plus, 75% of people in care facilities have Alzheimer's or dementia-related issues. Whereas in Brazil, most people living with Alzheimer's disease or dementia are being taken care of by caregivers or families. This decrease in life expectancy in those living with the disease, whereas in Alaska, most people ages 65 to 80 live 4 to 8 years, but in some cases up to 20 years. By having professional health care, one's life expectancy and quality of life can increase. In conclusion, the nervous system is a very complex organ system. Alzheimer's systematically disables the ability of cells to communicate.